Essential health benefits is, I think, one of the most important provisions of the Affordable Care Act. It outlines a set of services and benefits that all insurance plans, including those inside and outside of the state exchanges, must provide for people with health coverage. And all of these services must fall within at least 10 categories that are stipulated by the Affordable Care Act, including ambulatory services, preventive services, laboratory services. Those are among the categories in which essential health benefits offered by insurance plans must provide.
And what is Age United's stance on the current proposals from the Department of Health and Human Services?
In about mid-December, the Health and Human Services announced a bulletin which put forth what their intended approach to the essential health benefits package will be. Under the Affordable Care Act, the Secretary of HHS is supposed to define the essential health benefits. The approach that the HHS has chosen is to really pass it on to the states, and so that each state will determine the benchmark plan that will essentially be the essential health benefits. We have some very real concerns about that approach. It does provide flexibility, and it's designed to provide maximum flexibility to the states. One of the concerns that we have is that that leaves too much room, in our opinion, for variations among the states, and it doesn't set out as clear a standard for what the essential health benefits should be, which we think is the whole purpose and the letter of the law. So we are concerned that there's not going to be sufficient standards as to what benefits need to be part of an essential health benefits package, especially when essentially there are going to be 50 possibilities. We are also concerned that there does not appear to be an effort to define medical necessity. And medical necessity is critical for people with chronic disease management, including people living with HIV/AIDS. So having that sense of services that are medical necessity and ensuring that all people have access to services that are medically necessary is something that we want to see strengthened in the federal government's approach and guidance and to the states. And the final area that I would cite is around prescription drugs. We feel that what the government is currently proposing is a step backward. Under the Medicaid plan, Medicare Part D, for example, it sets out 6 protected classes of drugs, and antiretrovirals are part of that that set of protected classes. For the essential health benefits guidance that the Health and Human Services is working on, they're moving away from that 6 protected classes, which could suggest that antiretroviral drugs might not be in a plan, and that would be unthinkable for people with HIV/AIDS. So we need to make sure that all health plans cover the full range of antiretroviral drugs that are FDA approved.